Want to welcome everybody here today. As I was saying this morning when we had our Big Sky Economic Development meeting, uh, when this all started transpiring, uh, there were all the different spokes of the wheel, whether it be first responders or the hospitals and all these different things. And it became very evident very quickly that an economic arm of this needed to be actively involved in uh, our response. And from the very beginning, we knew that the Big Sky Economic Development and Steve and his staff were going to be vital in helping us do this. It shows that sometimes when you look at government, it looks kind of bloated because you've got all these different programs. Without the relationships and the experience that have been put together with all of this, we wouldn't have been able to pull this off in the way that we did. There's just absolutely no way economically we could have been dealing with all of the technical sides of COVID plus the economic portions of this, and try to put those teams together while treading water would have been impossible. So I want to thank Steve Arbuskow and his staff for all they've done and keep doing, and understand that this is going to be a marathon race, that this was not a sprint. And we learned that very quickly into this pandemic, that this was going to be vital. So welcome to everybody. I'm glad you're here to participate and to listen and to learn. And as I've done almost every time I get on a meeting, and I'm going to ask Dr. Graham at some point to start paying me royalties, but I encourage everybody to read his book, From Killer to Common Cold. It's become my Bible, and I make everybody I can talk to read it, because I think it really is giving some solid information as to how we're getting through this and what the future looks like. So welcome everybody, and enjoy your time online.
Thank you, Mr. Pittman. I'm glad that you got us started today. You guys, I am Karen Gross. I own Canvas Creek Team Building and Coaching, and I am privileged to facilitate this event today. My job is to help keep us flowing along, help keep this going, but also to bring in some of the human stories. Steve often reminds us, especially on the economic response and recovery team, that this is not just an economic story, it's a human story. So I'm going to start with a couple of human stories. The first story is sadly not a happy story. We are losing a 15-year business here in town, and I get to tell you just a tiny bit about that. It is Party Time Plus. They have decided to close their doors. And I know that we all have just a moment of shock and sadness as we hear that news. So I talked with Lene this week and asked her about how she was doing and what the process was and kind of what her thoughts were. And she feels like she's living a really bad dream. She can't believe that this is happening. When the year started, they were experiencing 15% growth over prior year, and prior year had been a good year. Then when COVID started, when we had the shutdown, they had 100% cancellations just within days. Everything just canceled and shut down. So they spent the summer limping along, doing everything that they could to keep their business rolling. She said, we just kept getting skinnier and skinnier, and everybody doing more and more jobs. They tried to make this work. She felt that there were a couple of things that made that really hard. One was that there might have been a little bit of an overreaction early on in the process, and that we just didn't really think things through. And she felt that the grant process had some glitches in it that were a little bit inequitable. And it was very interesting to talk to her about how she feels that should have been handled. And she's not bitter about it, but she definitely feels like we could make better decisions if we spoke more often as a group, which is what calls like this are for, is bringing us together and helping us figure out the very best way to do things. The second point that she had for long-term businesses in Billings was a very interesting reminder about how very important it is to shop local. That shopping local is more than just shopping local and saying I shop local, but this is the way we feed breadwinners and we put shoes on children's feet. And Lene said, this is how our community rolls, is shopping with the local people who are paying our community members to be here. And because she had to lay off her staff, it was family members, it was friends, it was long-term coworkers. Her longest employee had been with them 15 years. The shortest employee had been there for 2 years. She felt just amazing pain in having to pass along the decision to close. But the third point I took away from Lene was how privileged she was to get to make that choice. She had a strong business, a community that supported her really well. And she felt that that was really, really powerful. But she had to decide if she was going to borrow herself into bankruptcy or if she was going to close while her assets still outweighed her debts. Not everybody gets to make that choice, and she is very glad that she got to make that choice, but she's hoping that as a community we can pull together and really support our local businesses and really make careful decisions for those businesses so that other people don't have to make the decisions she is. But there's a whole team of people on this call that I know want to help you make those decisions if you are going through that process. There are people here who will help you carefully and thoughtfully make the very best decision for your business, which is why we're here. Now, the second story I'm going to tell you is a little bit different. This is one with a little bit more hope and a little bit of community resiliency. I run a Facebook group called I'll Help Billings. The basis of that page is that people who don't want to be foster parents help foster families. A foster family can go on there and say, I need soccer fees, I need formula, we just took in a new child, we need a bed. And people like you and I who aren't foster parents can say, I'll help with that. Well, you guys, this amazing community now has 6,000 members. And before the pandemic, we brought in 3 helpers to every one person who was asking for help. In the last 2 months, I've seen a dramatic change in the demographics on that page, and we're bringing in 3 times as many people asking for help as who are wanting to give help. So if you're able to help at all, I'd love for you to just jump on that page and help us. But the story I want to tell you is exactly that. It's how the community came together and helped somebody. We had a woman who is raising 4 grandchildren, and she's trying to raise those grandchildren outside of the system on jobs that generally pay minimum wage. And she quite often asks for help. And just before Thanksgiving, pardon me, just before Thanksgiving, she reached out to me and said, here's where we are. I lost my job because COVID closed the business. I got sick with COVID, and I was so sick they wanted to put me in the hospital, but I couldn't go because there was nobody to take care of the children. While I was ill, my dad died. We don't have winter clothes for the kids. We don't have food for Thanksgiving, and I'm 4 months behind on rent. Now, I know all of you can imagine what that feels like, being 4 months behind on rent and not being able to feed the little children that you were charged to take care of. So I put out a request on the page and said, will you help us take care of this community member? And within hours, every single one of her needs had been filled. We got Thanksgiving dinner for her. We got months and months of rent paid for her. And people wrapped around those children with clothes and with toys. And Christmas will be taken care of for that family. So that's what I want you to think about as we go through the rest of the call, that there's such resiliency and such giving and such hope in this community, that we are the type of place that is willing to wrap our arms around one another and say, I'll help you out and we're going to be just fine. And as we go through this call today, we're going to hear some hard numbers and we're going to hear some hopeful numbers. But I hope that you'll keep that in mind, that we are the type of people who pull together when times are tough and do an absolutely amazing job of taking care of one another. So as we begin this process, we're going to hear about numbers. If you know me, you probably don't think that I love numbers, but I do. I am all about digging into the numbers and how do we change them and what do they mean and where do we go from here based on what the numbers are telling us. And there is nobody who loves numbers more than Allison. Allison Corbin is an amazing person who digs into the data and tells us what she means or what it means. So I absolutely admire her and I'm anxious for her to tell us about the coordination response and kind of our economic roller coaster. And she's going to be joined by Andy Zoller. So Allison, please take it away and tell us about the numbers.
All right, thank you, Karen. So to give context to where we've been in the last several months since March, we always like to start of where we were coming from, so where things started. We like to reflect on what was happening before we went into the COVID-19 economic disruptions. So prior to that, we always do this economic pulse evaluation where we look at economic and data trends that we need to have our eyes on, especially as we relate to peer communities. And so some of the challenges we knew that 40% of our workforce would reach or exceed retirement age in 10 years. We knew that 22% of our workforce currently is 65 years old. We also knew that our GDP had finally just reached a point where we exceeded the 2015 GDP, which was good. We were really pretty a strong economy going into the COVID-19 disruption. And then our median household income kind of is one of those factors we like to keep our eye on because we kind of trail our peer communities in wages. And so this just gives us a little backdrop of some of the opportunities and challenges that we saw going into 2019 or 2020, some strengths, some weaknesses. But then, as we all know, the COVID-19 disruption really hit us. And the four factors that we really like to think about when we are walking through what economic impact has occurred in our community and what we need to be paying attention to really come down to economic production. So that's one, economic production and business activity as a whole. The second is employment. So what are employment numbers and trends doing? Consumer behavior, and finally, community health. And so when we look at those factors, there are factors that are leading economic indicators and some that are lagging. So what we all wish we could look at today is, what is our GDP doing and what is the activity occurring there? And that's not a number that we'll have for another pretty much a year after it occurs. And so that kind of bottlenecks us. So what we did is try to get at that with some local community data that Andy was able to compile. Factors. When we were looking at, when this first happened, we were turning to an economic analysis firm that really looked at the vulnerability of counties throughout the nation. And some of you may have heard this before, but Yellowstone County is in the top 10% of most vulnerable counties. And that comes from the fact that we are really a regional hub. So many people come to our community for things like professional services, for recreation, for hospitality. So we are more vulnerable than some of our peer communities. And it's something that we're keeping our eye on because 7 of the 10 most vulnerable communities or vulnerable industries are ones that have a really high concentration in our market. So 7 of the 10 that you see on this list, we have a higher concentration than the United States average. So we're just keeping our eye on all these industries and seeing what's occurring from both an employment perspective and also from just general economic activity. So that's one of the large scale factors we can look at when we're looking at our economy, but I'll turn it to Andy to give you an idea of some of the local data that tells the story of what our economy is doing.
Thanks, Allison. The city monitors a few, I would say, indices that to try to track what's happening locally in the city of Billings. One of these is new construction and building activity. The chart there shows 2020 compared to 2019 building permit activity and construction valuation. We've been monitoring this because construction and property values really drive property tax revenue at the city and funding services. So we keep a close eye on this throughout the year pretty regularly. And what you'll see actually was building permit activity was a little bit higher in 2020 compared to 2019. However, that was almost, that difference is almost fully in residential permits. Still kind of slow activity in commercial, but it was actually pretty heavy residential construction this year compared to last year. You can go to the next slide. This here is our business license activity. This one we started watching right at the beginning of the pandemic, anticipating that the business activity would really slow down. And it did in April, and we didn't see a lot of new business license application, but it did actually pick back up, I think, through the summer. I'm trying to pull it, okay. And when comparing 2019 to 2020, we're pretty well spot on total new businesses through the year, just under 700 new business license applications. We also track renewals, which we don't have a slide for, but I'll kind of talk through that. So as annually businesses renew their licenses, I wanted to watch that as well to see if we saw a big decline in the number of renewals, indicating, loss of business in our community. Fortunately, we didn't see a lot of that. From March through the end of November, we had about 4,300 renewals in 2019, and for 2020, about 4,200. So a little bit less, but I wouldn't say it's a significant margin. And then the next slide, the final thing that we've been tracking at the city has been the number of employments. This really correlates to our hospitality industry. Because we don't have sales tax, there's not a lot of ways for us at the city to track spending activity. But we know that travel had declined for the city, or all nationally, and that's evidenced here. Our employments are down quite a bit compared to the prior year. We are sitting at right now about 50-60% of what we have had historically. And as you can see on the chart there, in April, it was almost down to nothing. I think it was just 2,500 passengers through our airport. Pretty small when compared to years prior. And that certainly had an impact on our hospitality industries. And I think that's all I have.
Yeah.
Allison?
Yeah, thanks, Andy. And I think it was interesting too, just talking with Kevin Plone, the airport director today, that while our community is at 60% of what it was in the same year or in the same month, the US average is really more around 30%. So we're doing double what you see other communities throughout the nation doing. So that's encouraging for our market, and the state of Montana as a whole has done well through, as far as recovery is concerned, and employments for, and a lot of it was tourism driven. So this next slide has a lot of numbers on it, but this is still looking at that whole picture of what is our economy doing. And just a few quick things. We like to track how much money actually came into our community to support businesses. We feel like the more money you can get driven into our community, the better we'll do. So you'll see we got 14% of the state awarded funds were awarded into Yellowstone County. That's at 88 million. We peaked at 9,600 people filing unemployment claims, now down to 2,500 people filing unemployment claims. And in a recent survey by the chamber, the concern about COVID is still out there. They said nearly 50% of businesses reported that they're concerned if things don't improve when it comes to COVID-19 infections, that they may have to reduce staff or operations. So this just kind of gives us a picture of what's happening in the economy as a whole when we don't have the data like GDP available. So I'll kind of zip through this. Once we get out of general economy, we look at employment, and that tells a strong story because employment data is collected on a more regular basis than you see general economic data collected. And what I want to just highlight here is just the peak that you can see in that really tall line that shoots up in mid-April. It peaked. That top line is leisure industry. So of the unemployment insurance claims filed at the peak of our unemployment time because of COVID, nearly 30% were from the leisure industry. So that includes hospitality, food, restaurants, and tourism, travel. So you can see that industry was dramatically more impacted than the rest. The second line there that you see, that's the next down, is actually self-employed. So self-employed folks filing for unemployment. So I just think that gives you a picture of what area of our community was hit the hardest. When we look at trends of unemployment insurance claims, I put a side-by-side with the United States. This is most recent data, came out on December 5th as far as unemployment in the United States versus unemployment in Yellowstone County. And you can see that the trend is relatively similar. I tried to stretch out the chart a little bit so you could have an equal picture. But as you can see, we are actually perhaps even getting closer to where we were before COVID-19 disruption, but you could see that spike occurred and we've been traveling down ever since. You do see a little turn up at the end of that chart, but that's really related to seasonality that you would expect in a normal year anyway. With it's getting colder, construction type folks, are starting to file unemployment because the season is over for them. So you have all of that seasonality is pretty typical. So, and when we look at when we look at this information, we also look at how many jobs are available in our community today. And there are about 3,000 postings in our community today telling us that there's more job postings than there are people filing unemployment insurance. There might be gaps in skills and abilities, but we do know that jobs still exist in our economy. Finally, we like to track the consumer spending. We know in Montana, spending is down 9.4%. We don't have a local Yellowstone County data point on that, but we're watching that closely because that's consumer confidence, consumer willingness to spend money is going to be critical to our recovery. And that's why we're always saying, shop local, keep your cheer here. And so that rounds out the slides that I have today. But the final point that we talk about is just how well we like to keep track of what's happening with community health, because community health will be a huge driver in how consumers engage and how we continue to recover from the economic disruption.
Part of the human story and the business story, we have the story of restaurants and what has happened with them during the pandemic. And I'm really anxious for you to get to hear from Mike Craighill. Mike, are you ready to come on and talk to us about Soup and Such and tell us how things are going for you?
Ready.
Great, Mike. Thank you for being here today. And we just want an update. Where are you? How are you feeling? What's going on with you and your restaurant?
Sure.
Restaurant.
Well, as I'm sure everyone realizes, it's a tough time to be in the restaurant business right now, and specifically a tough time to be a restaurant that is buffet, as a business model. And so, when things were going very well for us for, quite a long time. And then when COVID hit very, very quickly, things, started going in a downward trend, culminating with us having to close for a couple of weeks and then kind of regroup because we weren't really set up for the takeout model. We did a little bit of takeout, but our bread and butter was the buffet. And so, we regrouped, we built a pretty robust ordering system for delivery and for carry out, set up car side, typical things that a lot of different restaurants did. We were just doing everything that we could, to survive. We put some different lines, some more home meals and sort of take and bake options, things like that. And so, that's kind of, we started with that. And then, the summer was very rough. I mean, when we were able to get patrons back in, it was tough. We don't have, there's just not as many people out there. There's just, the travel industry, as the slides show, was pretty much decimated for over the summer. And that's where we rely on a lot of, especially at our West End location, a lot of the, business comes from tourists and people being out and about. And then that combined with just people being afraid and not, understandably so, not wanting to go out of their homes. The summer was tough. And we were really hoping for a more robust recovery over the fall, but it just hasn't materialized right now. We're doing roughly right around 50 to 55% of our normal sales. It's not a sustainable model.
Yeah, it's a scary model, isn't it, Mike?
Yeah.
Right now. Yeah. And when you look out at the community, I know so many of us have said we want to support you, but how can we support you? What does it look like right now? How do you feel about that?
Sure. Well, we have had a lot of people reach out to us and what can we do? And a lot of people that have purchased gift cards and, come in or made a point to get takeout. So, I would say I really am very appreciative of the community. I think there still is a gap. I think that people, when things are hard, they revert to comfort. And so, I was in my restaurant earlier today, and Thursday, Friday, Saturday would be our busy time. I left the restaurant. We had a couple of tables, and I left, and McDonald's drive-through was backed up, and Taco Bell drive-through was backed up, and it's hard. It's hard to see that, and I get it, because like I said, I think there's a comfort in that type of thing, and also they were better prepared for something like this than we were, certainly, and so they were much better. But if there's one thing that I could reach out to people and just it really is just eat at our restaurants. Order to go, or come in and eat. That's going to be the big thing right now. There, with the vaccine on the horizon, that brings a lot of hope for us that if people get vaccinated, or enough people get vaccinated that others that haven't been vaccinated or waiting for it feel safe to return to normal, which in my hope would be by the summer, then maybe, then we'll probably be okay. We've dug a hole. Your story about Party Time Plus, we sort of made the decision that we borrowed beyond the forgivable PPP loans, which I also agree there was some glitches there, and we spent the money the way that it was originally designed, and if I had a Wayback Machine, I would have done that different. But we did, and that's where we are at. But then we went back. We went to the EIDL loan, which is a great, excellent terms to help us survive. I think exactly what's designed to do. But that's real debt. That's not forgivable debt. And so at some point, we'll have to start filling that hole back up.
Great, Mike. Thank you for telling us our story, or your story. We're really excited for you now to get to hear from the MedTech panel. And they're going to be talking about what we've learned from COVID-19, what that looks like going forward. And here to help with that conversation is Heather Fink. So Heather, please take it away.
I'm Heather Fink. I'm the Director of Health Provision at Riverstone Health in our Public Health Department, and appreciate the opportunity to introduce the medical technical team. So the Unified Health Command is made up of Riverstone Health, Billings Clinic, St. Vincent Healthcare, and then the Yellowstone County Disaster and Emergency Services. And as a committee of the Unified Health Command, we have the medical technical team. And that group really serves an integral part in being able to advise our health officer, and is meeting on a regular basis to really discern what's going on in the community in regard to medical and technical issues, and then bringing that information forward for our use. So I want to quickly run through the membership for that, and then you're going to hear from some of the membership. Those that are not joining us today are Kim Bailey from Riverstone Health. She's our communicable disease nurse manager. Nancy Iverson, our nurse director at Billings Clinic for patient safety and infection control. Dr. Koo from Billings Clinic, who is an infectious disease and internal medicine doctor, and Justin Baker, who serves in epidemiology at Riverstone Health. The three that you have the fortune of speaking with today and hearing from are Dr. Megan Littlefield, who's the Chief Medical Officer at Riverstone Health, and she will be speaking with you first. And then you'll hear from Dr. Larry Severa from Billings Clinic, who specializes in geriatrics and is in family practice at Billings Clinic. And then lastly, but not least, Dr. David Graham from St. Vincent Healthcare with infectious disease and internal medicine. So I will now hand it off to Megan, and you can take it away.
Great. Thank you, Heather. Thank you all for giving us the opportunity to come in and chat with you. This last year, this unfolding pandemic has been such a whirlwind for all of us. And I know we are all really tired of hearing that phrase, that it's a rapidly evolving situation. And so first, I want to talk with you a little bit about some of what we have learned through this. And so I'm sharing my screen. Can you all see the screen? Yeah, okay, excellent. And so let me just make sure I can get to my, there we go. So first I'm going to talk a little bit about what we've learned. I'm going to talk a little bit about what some of the common myths are that still exist. And then I'm going to talk a little bit about what the new options are for quarantine, since I think that that will affect some of you and some of your employees. So what have we learned? We've learned, first of all, a lot about how COVID-19 is transmitted. We know that it's primarily spread through respiratory droplets. The virus invades the cells in the respiratory system, in the nose, in the airways, in the lungs. And then respiratory droplets are created every time we talk, every time we breathe, yell, cough, sing, sneeze. And so the virus is in these respiratory droplets, and the heavier droplets, we know when they're created, they sort of stay suspended in space for a short period of time, and then they fall. And what we have, learned from the modeling and just from how the infection spreads, we've sort of set 6 feet as that risk area of where these respiratory droplets sort of stay suspended in the air. And so we know that that physical distancing piece is really important, because the further away you are from someone who has the infection and is spreading these respiratory droplets, the less chance you are of getting infected by the respiratory droplets. But what we also know is that every time we talk, sing, sneeze, cough, there are finer particles that also are released, that are aerosolized. So these smaller particles that holds probably less virus, but they can stay suspended in the air for much longer periods of time. And so that's one of the reasons why we see increased risk of spread when you're in closed areas or small areas that have poor ventilation, because you have someone who might be in there talking and breathing and sort of shedding these virus particles into the lighter particles into the air, and they're staying suspended in the air. That person might leave, but another person who comes into that space is then exposed to these viruses that are in the air. There was actually one study that was done that said that an infected person who's just talking normally can exhale millions of these virus particles every hour. And so you can see how that really can impact the way spread occurs. We also have learned that there is a significant amount of spread in people who either don't have any symptoms at all. About 40% of people who have COVID have very mild or no symptoms at all, and also in this pre-symptomatic period. So we have learned that people are probably are more infectious, more contagious in the first 2 days before they have symptoms than during their illness. And so you can see why it becomes so important that we have these measures in place about masking and the distancing, and why hygiene becomes so important. Initially, we thought there was a lot of spread. We were really concerned about the risk of spread through contaminated objects or through the contamination of surfaces. And as we've learned more about this virus, we think that plays less of a role. Still might have some role, still important to do good surface cleaning, but that the respiratory component is probably a much bigger component related to spread. So the second thing that we have learned is that COVID has so many different symptoms. Early on, we talked a lot about how it was fever and cough and shortness of breath. And while we still do see those as main symptoms of the disease, many more people have many different symptoms. There are some people who present with mild cold-like symptoms, or back when it was allergy season, there were lots of people who felt like they just had allergies, mild sore throat. Some people have, severe body aches or just this significant sense of fatigue. Some people lose their sense of taste and smell, which actually correlates pretty highly to this virus. And some people have a whole bunch of these symptoms, and then other people just have one or two of these symptoms. And so it makes it really difficult to make a clinical diagnosis without testing people for COVID-19. And this is going to become increasingly true as we move into respiratory season now, where there are other viruses around that cause very similar symptoms. And it's very hard as a physician to tease out whether this is just from a mild cold or whether these symptoms are related to COVID. The third thing that we really have learned is that COVID affects people very differently. So some people have this mild illness. Most people, thankfully, have a mild illness that resolves quickly. But then you have other people who end up with prolonged hospitalization, needing, incredibly intensive services to, and ventilation and ICU care and post-acute care, weeks in the hospital. One of the reasons why our hospital census remains so high is because some of these folks are in the hospital for weeks, which is very different than other illnesses that we typically see. And then other people have mild symptoms that resolve, but then they develop these long-term sequelae that sort of hang on for a long period of time. And so, we know there are some specific risk factors for severe disease, and those include, older age, gender, race, obesity, diabetes, chronic medical disease. And we know that they have risk factors for having pretty significant illness, but then we sometimes see people who don't have a lot of those risk factors and still become quite ill. And we don't know why some people get very ill with this and other people do much better. We have fortunately seen a decrease in our mortality rate. So the number of people who are dying from this disease has decreased since March. And we think that's largely because we've learned a great deal about how to take care of people, particularly when they're critically ill, how to use oxygen, how to ventilate, and how to position people. And I think Dr. Graham's going to talk a little bit about some of the other treatment options. And then, as I mentioned, this long hauler syndrome, which is what we're sort of starting to see now, are these people who get better, have mild disease, really get better, but then they develop these lingering symptoms of, sometimes disabling fatigue that prevents them from being able to go back into the workforce, or exercise intolerance. Mental clouding, and there's a lot that we're still learning about what puts people at risk for having those types of symptoms. So next I'm going to move on to a couple of the myths that we sort of still hear about. And so the first myth is this thought that COVID-19 is not as serious as the flu, or is very similar to the flu. So while it is true that most people have mild illness when they have COVID, and arguably most people have symptoms that really are less severe than the flu, as we talked about, there's this wide spectrum of how people are affected by this disease, and a much higher mortality rate. So we went back and looked at the number of deaths that were associated with influenza since 2016. So in Yellowstone County since 2016, 18 people died of influenza. When you look at how many people have died since March from COVID, it's 129. So clearly the mortality is much, much higher in COVID. The second myth that I wanted to talk a little bit about was if you are recovered from COVID or you have antibodies to COVID, that you're now immune. So this is an interesting question because we don't really know the full answer to this. We've only been able to study this virus for about a year. And so we're still learning what the long-term immunity is going to look like from COVID. What we do know is from other coronaviruses, so other similar viruses, immunity often starts to fade after 3 months. And so while we feel that there's likely immunity that's lasting for at least 3 months with COVID, and we suspect that it's probably longer. And in fact, during that 3-month period, if you've had COVID, we actually don't recommend that you go get retested except under sort of certain circumstances, because the likelihood is that you will actually pick up the virus particles from your previous infection, and we're pretty confident that you're immune during that time. We don't know how long that immunity is going to last. And we don't know if you go and get an antibody test and you see that you have antibodies, well, we're pretty sure that maybe that does show that you had COVID at some point. We don't know what the level of antibody in your blood has to be to correlate with immunity to the disease. So this is all sort of an unknown that we're learning about. Because there are a lot of unknowns, we recommend that even if you have had COVID, that you still continue to follow those recommendations of wearing a mask, staying physically distanced, and using good hygiene during that time to prevent any risk of infection. And so the third myth that I wanted to talk about is related to masks. And so do masks really help, or how do masks not really help the risk of spread? So there are a growing number of observational and animal studies that suggest that masks are effective. Some of this is based on studies from other viruses. There are also a number of randomized controlled trials that are sort of going right now looking at masks, but this is really a hard thing to study specifically. What we did talk about, and what we do know, and we talked about this earlier, is that 40% of people who have COVID don't know they have COVID. And the most infectious time is the 1 to 2 days before you have symptoms. And so what we do know is that just monitoring your symptoms and staying home when you're sick is likely not adequate to prevent spread. And what masks do is they do two different things. First of all, by wearing a mask, it decreases the amount of respiratory droplets that are getting into the air when you have the infection. And so it doesn't eliminate it. There's still probably those smaller particles can probably go out the side, probably can get through the material, but a lot of the larger respiratory droplets will actually get stopped before they go out from the source, from the person who's infected. And by wearing a mask, you actually prevent some of the respiratory droplets getting to you if you are in a space where there's someone who does have COVID. So it decreases the amount that gets out. It also decreases the amount that someone can get exposed to. And there are some interesting studies that are coming out that are suggesting that the lower dose of virus that you get can actually make you have less severe disease. And so by wearing a mask and potentially decreasing the amount of virus that you get exposed to, you could potentially be lowering, the impact of disease. But the bigger issue is decreasing that source, so decreasing the respiratory droplets that someone emits. The other thing is that masks really are safe. There's not a risk of increased carbon dioxide exposure. You don't get more sick by breathing your own air or by breathing your own breath. And most medical associations have really come out to say that there really are very few medical contraindications to wearing a mask. So the biggest take-home point is that there still is a lot that we're learning. As this pandemic has been unfolding, the science community is trying to strike a balance of filling this gap of information with the best knowledge that we have available at that time. And so we're constantly, as we're learning more, we're constantly updating the guidance that we have. And then in public health, we really are trying to balance the risks related to the disease and its spread with the societal impacts that we hear and that we know are happening because of the safety measures. And so as our knowledge of the disease increases, and the impact of this pandemic, our knowledge of how that's impacting everyone increases, so does our recommendations. And so, this kind of brings us to the most recent change that we have had in our recommendations, and that is related to the quarantine period. So, previously the CDC was, previously the only option for quarantine was that if you had been identified as a contact, so you had been exposed to the disease, identified as a contact within 6 feet for more than 15 minutes to someone who was infected, that there was a 14-day quarantine, that you had to be away from the society and isolated for 14 days. This still is what the CDC is recommending, and this is the best way to limit that risk of post-quarantine spread. But what we have seen is just that has a really huge impact on people's ability to work, on businesses being able to staff their workforce, on kids missing school. And so we have the CDC started to look at some other options that may be considered safe. And so the other options that they are offering as potential, as okay options, are being able to be released from quarantine after 10 days without any testing. And we really do support this in our community. We have to recognize that there is a slight increased risk of post-quarantine spread after 10 days. But that this really seems to strike a reasonable balance of risk and benefit of quarantine. There is also this option to end quarantine after day 7. But you have to have a negative test. So a negative test with a PCR test that can be done at day 5 or after, or a negative test with an antigen test as close to day 7. And so if someone meets that criteria, then they can be released from quarantine. It's important to remember that if you come back early, because there is that increased risk of post-quarantine spread, you need to continue to self-monitor, check your symptoms, make sure that you're not getting sick through day 14, and really use correct and strict mask usage during that time, and paying attention to social distancing and all of those other measures. The one challenge that we see with rolling this out in our community, is that our availability of testing is still somewhat limited. We're working on, trying to make that option better. So, we really, are continuing to learn about this virus. We'll continue to make recommendations that really are to the best of our knowledge at that time. We recognize that makes things confusing, but is really a sign of us, trying to make the best recommendations with the information that we have. I'm going to pass this over to Dr. Larry Severin now, who's going to talk about the impact that this has had on our long-term care facilities.
All right, so I'm Dr. Larry Severin. I'm a family medicine physician with Billings Clinic. I spend most of my time doing geriatrics. I'm the chair of the geriatric department currently, and I'm a certified medical director and go to 2 different nursing homes here in town. So I've had boots on the ground in nursing homes since August of '06, and really enjoy that population of people. Typically, geriatrics and nursing homes don't get this much excitement. However, with this pandemic, the vulnerable people that have really suffered tremendously is the geriatric people population that live in the long-term care nursing homes. For example, we know right now that over 106,000 long-term care residents in nursing homes have died from COVID. We know that 40% of the total deaths of COVID have come from nursing homes. Here in Montana, it's interesting, we actually have the 2nd highest nursing home percentage of deaths. We're 2nd only to South Dakota. They have a higher percentage. And we're the 4th highest in confirmed cases of COVID in the actual nursing homes. So currently there are 7 nursing homes in the region. So going from east to west, we have Eagle Cliff, we have Parkview, Aventera, Bellaterra, Aspen, St. John's, and Laurel Health and Rehab. So those are the 7 nursing homes that are in our Yellowstone area. What we need to know is that since early on in the pandemic, every nursing home has really worked tirelessly to keep COVID out of their facilities. It's been very important to be very aggressive, maintain significant attention to keeping this virus out of the nursing home. The United Health Command and the medical technical team has been very involved in this. We've done a lot of different things. Early on, we actually had a van that was able to go around to the different nursing homes and test residents, because early on we didn't have the ability to have that many tests. We were really shy on tests, and so the easiest way was to have actually a Riverstone van go to these nursing homes and test residents if they had symptoms. We've done education, we've done video conferences. There's a couple of us that meet with the administrators of the nursing homes every week. We do that every Tuesday. We sit for an hour, talk to them, find out what's going on, how are things going. We also do quite a bit of support and guidance, and a couple of folks at Riverstone, Hannah and Kim Bailey, speak directly with the different nursing homes, giving them guidance, what happens when you actually have a resident or a worker in the facility that comes down with COVID or exposed to COVID. And it's quite rigorous. It's actually quite difficult, partly because, just as Megan has said, there has been so many changes, and some of it you're going down a certain path, and there's recommendations that change from the CDC. There's things that you learn, and during that time we're having to give advice and be fluid and flexible with our advice and our direction. So two things I want to talk about predominantly, and that is what is our main focus, and then how has this affected the resident, the person who's actually living in the long-term care facility. So the number one thing, of course, is that we have to keep COVID out of the facility. Since early on, we have, there's been no visitors, residents have been isolated to their rooms, communal dining, visitors, as I said, activities have all shut down. So the resident can't go out and get COVID on their own. So we have to understand that these residents in the nursing homes are not going out grocery shopping. They're not going out with their family on holidays. So the way that we protect our nursing home residents is by keeping the staff safe. So the things that we're doing currently is, and this is through the state of Montana and CDC's recommendation, is that the staff of these nursing homes are getting tested twice a week for COVID. It's called surveillance testing. So twice a week they get tested. They also have, if you have symptoms, you can get tested right on the spot. Now, where we're at, we have rapid testing in the nursing homes. So if a worker comes in or a vendor of some sort, they can actually get tested right on the spot with an antigen test and see what their status is. Every nursing home has a checkpoint. So when you come into the nursing home, you have to fill out a form, you have to take your temperature, you have to wash your hands, you have to have a mask on. That form then gets signed by the lead nurse of that day, and then you're able to go into the nursing home if you have all the right answers. Of course, in the nursing home, people are wearing the personal protective equipment, or PPE. So when a nursing home is on outbreak status, which means that they have at least one resident or staff member in the facility that has COVID or been exposed to COVID, is considered an outbreak. And when they're in outbreak mode, all the staff have to wear masks. Well, they wear a mask all the time anyway, but masks, face shields. But when they're in outbreak mode, they wear gowns, gloves, sometimes some type of a head covering as they go in and out of every room. Now, you can imagine that caring for somebody, bathing them, dressing them, toileting them, doing their personal care, you're doing that with a mask, with a face shield, with gloves, with a gown, and you're trying to do this all at the same time. The biggest aha moment for me was when I talked to some of the bath aides. So in a nursing home, there's actually aides that help all the residents have a bath or a shower. And so can you imagine giving somebody a bath or a shower wearing a goggles or a face shield, some sort of mask, gloves, and a long gown? It's actually quite difficult, and it's strenuous. And so these people who are doing this work are quite courageous and under some pretty difficult situations. So we're able to test them more often. We're able to screen people as they come in and out a lot more efficiently. What happens is that as a lot of the workers who are in the nursing homes are actually younger, a lot of the CNAs, the kitchen staff, the housekeepers. And as Megan was saying, a lot of these folks have minimal or no symptoms. And so it's really important that as a community, we are protecting these workers By protecting the workers, we're protecting the nursing homes. And so that's why it's important that we have masks, that people are wearing masks, that we're keeping 6 feet apart. And I appreciate the businesses that are doing everything they can do to help enforce those recommendations and guidances, because it's actually saving lives in a nursing home. But the one thing that I want to just jump into quickly is, what is the nursing home resident actually going through? So think about your grandpas and grandmas, your aunt and uncles, or maybe moms and dads. Maybe you have family member who's in the nursing home. Since early March, these residents have not had visitors. They've been in their room. They don't get to go out for communal dining, so they eat all 3 meals in their room. They don't have any activities with other residents. So when I'm walking up and down the hallways, it's frequently the residents are sitting at their doorways, just looking up and down the hallways, saying hi to their neighbor, because that's about as close as they can get. So not eating together, not having activities together, and being social distance at all times. What I'd like to do is just give a quick story. As Karen has been saying, these stories are really impactful, and I have actually a good story. It's kind of sad in the beginning, but it gets better, and this patient doesn't get COVID. But I want to tell you what happens to just a regular resident. So I have this patient that I'm going to call Betty. Before the pandemic, she fell at home. She went to the nursing home. She went to the hospital. She had her hip replaced, and then she went to the nursing home for continued therapy. While she was at therapy, the pandemic started. It came into Billings. We closed things down. So her family now aren't able to come in. Her family's not bringing her favorite food to her. They're not visiting her. She has to do physical therapy in her room instead of going to the physical therapy gym. And as you can expect, it was actually really hard on Betty. I sat in her room with her, and she many times just would sit there and cry, because she has lost all contact with family, with the other residents, and was very isolated. So what do nursing homes do in this case? Well, I was really impressed. This nursing home noticed this, as all of them are. They noticed that this isolation is actually very difficult on them. So we increased the activities that the person was involved in. We got social worker to come in and talk with them. And slowly she began to perk up a little bit more and participate in therapy more, started actually eating. She was losing weight. I was concerned that she might not actually make it because of this isolation. Finally, she started to eat, she got better, and she graduated out of the nursing home and went to an assisted living. And just last month, I went and sat with her again. She's now full of smiles, she's feeling better. She still can't see her family. And when I talk to her, she basically says, in essence, I've gotten used to it. So what has happened in our long-term care residents is that they've gotten used to being isolated. They've gotten used to being social distance. They've gotten used to eating by themselves in their room. And so just to echo what Mike Craighill said earlier, we do have some hope now. We have more rapid testing. We have more understanding of the disease, as Megan was talking about. We also have this hope of the vaccine. How it's going to change, when it's going to change, what it's going to be like. Hopefully David Graham will give us all the answers. But we do feel like we have some hope. And I just want to echo Mike that it's been a long time. It's been a long season. And I really appreciate the city of Billings, the restaurants, of just saying, hey, we're going to do what we can do to protect our residents. So I really appreciate each one of you implementing people to wear masks, social distancing, all the work that you're doing. We really appreciate it. It's actually saving lives in our nursing homes. So I want to say thank you.
Thank you, Larry. My name is Dr. David Graham. I'm an infectious disease doctor, and honestly, it's my privilege and honor to be here in this august group. And I was asked to talk a little bit about the medical aspects of COVID, So hopefully pretty briefly we'll mention medications that are currently approved, the vaccine, and I'll give you maybe some comments about what I think the future will hold. And thank you to Commissioner Pittman for mentioning my book, which is really honestly what I think the future will hold. So getting right to it, why is a virus difficult to treat? Why don't we have many medications against viruses? And what I would like to do is remind you all that viruses are dead. They are not living things. They're bags of protein and genetic material that are zombies. The only way they become alive is they get in our cells and they use us. They use our replicatory machines in our cells to make more of themselves. That is honestly their only goal, is to make more of themselves, and they use us to do it. So in order to kill them, we actually have to kill us. It is really difficult to find a way to get the virus out of our cells without harming our very cells. So it's been challenging to have medications be approved. In the hospital, we do have two, remdesivir and convalescent plasma has also been approved. So that is antibodies from people that have had prior COVID infections. As to the effectiveness of these medicines, I'll just mention that the World Health Organization, the WHO, has not approved these medicines because they don't think they work very well. And that's really my feeling too. These are kind of like a spit gun against an elephant. They don't really move the dial much in this disease in the hospital. Fortunately, an older medicine, dexamethasone, which is just a steroid, we use steroids like prednisone all the time, probably does have some effectiveness in decreasing mortality. So what has really helped is we've figured out how to treat these folks in the hospital with oxygen rather than intubation if we can. We prone them, we flip them over. We try to not intubate them, and we give dexamethasone. So in the hospital, we're definitely doing better, but it's really because we've learned about this disease rather than we've had new medicines about it. So more recently, monoclonal antibodies have been approved, and this is for non-hospitalized patients who have significant risk factors. And both hospitals are giving these now. And I won't give you my personal opinion of how effective these medicines are. I'll just say that my society, the Infectious Disease Society of America, has recommended not using these medicines because they probably don't work. So as far as treatment goes, it really is disappointing as expected because these are viruses and they're hard to get treatments against it. So on to vaccines, which is much, much more promising, because how do we as humans prevent viral diseases? It's through our immune system. So a vaccine is the way out of this pandemic. And we do have two vaccines that are coming down the pike. In fact, the FDA panel just recommended this hour that the Pfizer vaccine gets approved. It got recommended 17-4 at the FDA. It'll be really interesting to hear what those 4 people have to say. This vaccine is surprisingly efficacious. Okay, it works. It prevents disease. It probably prevents severe disease. It may even prevent infection. So it may prevent transmission from person to person via this asymptomatic phase that Dr. Littlefield was mentioning. So this is something we really need to get people to understand, that it is probably in their best interest to take this vaccine. It is very efficacious. It will not be effective unless we get it in people's arms, right? So that's what we need to do. And in order to do that, it's important to understand that there are side effects to this medicine, okay? 1/3 of people do have mild side effects after the first dose. Their arm hurts, they feel a little weak, they could have some low-grade fever, they're tired. However, after the second dose, up to 40% of people may have mild symptoms after this. So before the story goes around that this is a horrible vaccine, we need to let people know that there's gonna be some mild to moderate side effects from getting this vaccine, okay? There's only about 2 months of safety data that they released with this Pfizer vaccine. There's some concern I have personally about Bell's palsy. I hope the FDA mentions that. But really, if you are at risk yourself, or if you are around someone who is at risk, we know COVID has some pretty bad outcomes. So what is the risk benefit of anything we do? In medicine, nothing is ever a slam dunk. There's always two sides to it. There's always risk, there's always benefit. Right now, if you have significant risk factors, or if you're around someone that has significant risk factors, this vaccine is what we need to do. As to the future, so what does the future look like? Well, in the short term, let me mention that, well, we have been going through this epidemic here locally. It's called the third wave, but this is our first wave here in Montana. And it's been going on for a long time. It's been going on for 2 months. And frankly, it's been going on for about 6 weeks before the national media even noticed. So we are flyover country here. They don't really care what's happening to us in Montana, North Dakota, South Dakota. Literally, North Dakota was 3 times worse Arizona was during the summer wave before anyone noticed. There was 3 times more cases going on in the Dakotas than in Arizona, Florida, Texas this summer before anyone noticed. So you can't really rely on the national news media to recognize what's happening here in Montana. And I would have you essentially ignore what they're saying right now about what's going on in the Midwest, because hopefully we were on the downward side of our curve. Hopefully we weren't along the exponential growth curve during Thanksgiving, okay? We had lowering of cases, we had lower positive test rates. So hopefully we didn't go into Thanksgiving with this exponential growth curve. What we will see over the next couple of weeks is what our cases do. And really what we need to do is kind of get our cases to go down before the next holiday, because we mix differently, right? During our working days, we're with different people than we are during our holidays. And what we don't want to do is have a lot of cases and then go ahead and start mixing with other people and then go back to mixing with another group of people. So the vaccine is coming. It's going to take a long while to roll out. I do want to caution people that the vaccine does not mean the end of this virus. Okay, we cannot eradicate COVID-19. There are criteria based upon which we look at viruses as candidates for eradication, and COVID meets 0 of 3 of these criteria for eradication. Okay, so there will be cases, there will be hospitalizations, there will be death, even with the COVID vaccine. So we still need to keep doing these things that we know work, and that means not swapping air, okay? Don't share air with people. If you do, wear a mask, okay? We need to be cautious even though the vaccine happens. And honestly, kind of what I'm looking forward to is January 2nd and January 20th. A lot of things are going to change as far as how this will play out in the summer. As we get more people vaccinated, we'll see what the CDC recommends we do for mitigation strategies, both nationally and here in Yellowstone County. So I'll keep my remarks short and there. Thank you. Do I get to introduce John Felton? John Felton is probably the hardest working guy with the toughest job at Yellowstone County right now. I really admire John because he understands that, boy, these are tough decisions we have to make. And when we know what's the right thing to do, man, it's easy to do. It's hard when we don't know what the right thing is to do. So John, I really respect the work you've done for Yellowstone County, and I want to thank you.
Thank you, Dr. Graham, and thank you all for the opportunity to speak. I think I'm going to be fairly brief, but I want to sort of follow on to some of the comments you heard from our medical staff, and that is this idea of balance. Dr. Graham said, you know, there is no certainty in terms of, you know, nobody ever has a side effect, so there's a cost and a benefit to everything. I think balance is the real story of trying to manage life in the pandemic. You know, we realize that every time we impose more restrictions, whether that's hours of operation or occupancy or whatever it is, there's a very negative impact economically and socioeconomically and psychologically of those reductions. The benefit is that disease transmission goes down. If we don't have those restrictions, then disease transmission goes up, more people get sick, more people get in the hospital, and more people die. But we get a greater sense of normalcy. So there is no magic answer. I do think that we've kind of become a little bit numb to the numbers. Right now, we are down, as you heard from our physicians, right, as of today, our 7-day average is 79 cases per 100,000 per day. That's 125 of our fellow residents that get ill every day. It's 875 of us who get ill every week. Certainly it's better than when we were well over 100 per 100,000, but it is still a lot of people getting ill and requiring care. I also want to mention this, this idea of how restrictive we should be. I can tell you what the CDC would say, given our counts, which are in the critical level, above 75 per 100,000. We saw that we're kind of sort of holding our own with travel. All travel should be avoided. Gyms should be closed. All schools should be operating remotely. There should be no gathering outside of households. All bars should be closed and restaurants should be at 25% capacity. We really try to avoid those things and strike a balance, but it all incurs risk. As Dr. Graham mentioned, things are going to change in the near future. We have a new governor coming in into the state. That is going to presumably have some impact on how at a state level we manage the pandemic, what sort of restrictions are put in place. I know the governor-elect Gianforte has several subgroups within his COVID-19 advisory group that are looking at and helping him decide what to do when we get to January and he assumes office. We don't know what that is. We will see what changes come when the new governor institutes whatever the state is going to do. So I think that is an important date to look forward to. You've heard a lot about testing. Testing is a real issue in our state and in our nation. There's simply not enough. Dr. Burks came to visit us back a month ago or so, and her recommendation was that Yellowstone County should undertake asymptomatic testing, basically looking at about 10% of the population. She recommended that we do 15,000 tests of asymptomatic people a week. The most that can come to Yellowstone County of those tests is 2,000 a week. So we have to use those for symptomatic people. As Dr. Littlefield talked about, you can get out of quarantine a little earlier if you have some certain testing under certain time frames, but we don't have enough capacity to do that. So those who can afford to get tested may be able to do so, but it's not going to be readily available right now. We continue to work towards getting as much testing done as we can, but our focus has to be on those who are symptomatic and those who are close contacts to try and slow the spread. I'm happy to say that we have seen as we've seen a reduction in cases, we've also seen a reduction in the burden on our 2 hospitals. Right now, we have somewhere around 120 COVID inpatients in our 2 hospitals. I'm sure you'll hear more from Dr. Elner and Steve Lovelace about that shortly. We were up as high as over 150 COVID cases in our 2 hospitals back in the earlier part of November. And what we have to remember a few things about this. One is about half those people are Yellowstone County residents. And I've had a lot of people say to me, well, the answer is just stop letting the non-county residents into our hospitals. But we've spent, as a community, we spent 40 years positioning ourselves as the regional medical center. And we can't just do that when it's convenient. So this is what all of our systems are built on, all the relationships between our 2 large hospital systems and the critical access hospital systems in the region, the way specialty care is spread out through the region. This is our job. And so that half non-Yellowstone County is pretty typical for our hospitals. And as we've had a lot of COVID patients, we've had a lot of out-of-county patients. But that's what we do. So hopefully if cases continue to go down and we can avoid having a holiday surge, then we can keep the pressure on those hospitals down. Hospitals have done a marvelous job of expanding their capacity and finding ways to make sure that we always have room for another patient, that nobody's getting turned away. We should all be extremely proud of our 2 hospitals and the way that they have managed a really, really difficult situation. And the last thing I want to touch on briefly is the vaccine that Dr. Graham talked about. Vaccines are coming. As he said, the Pfizer vaccine has been approved. We anticipate the same will happen with the Moderna vaccine in the next week or so. We expect to get our first shipment of Pfizer vaccines into Billings next week. We had a call with the manager of that program at the State Health Department a little while ago, and we think that a week after that, we could start seeing Moderna vaccines. We just have to remember numbers. The math is important. We're going to get less than 2,000 doses next week, and the high priority recipients of those doses are going to be our frontline healthcare workers and nursing home residents, as well as nursing home staff and our first responders. 2,000 doses just isn't going to go very far. We have two very large, very comprehensive healthcare systems. We have Riverstone Health, and between them, that's going to rapidly go through those doses at just the very top tiers of that first level. I know that we all see the light at the end of the tunnel with the vaccines. I think that's true. We just have to remember we're not at the end of the tunnel. We're probably, most of the estimates are saying late summer, early fall of 2021 is when enough vaccine is going to be distributed to the general population to really get the full benefits of having a highly vaccinated population. So we still have a ways to go. I know that the restrictions have been extremely difficult, and I think we all try to do our part to support our businesses as best we can with gift cards and takeout and shopping locally. It's this balance that we must, that in my position, I need to try and strike between keeping our economic vitality and sense of social connectedness going, as well as avoiding any more spread of the virus than we can stand. So I appreciate what all of you are doing. I know these are extremely difficult times. The only thing I can say is, in closing, is hopefully it's another 100 years before we do this again. It's been 100 years since the last big pandemic, and hopefully we make it another 100 years. So with that, Karen, I'm going to turn it back to you.
I love that idea that this might be the last time we have to do this for 100 years. That's great news. So doctors, thank you so very much for your presentation today, for the work that you're doing. I know that I really appreciate that you are worrying about those great big things for our community, and I can worry about wearing my mask and what I should stream on Netflix, as the poll showed earlier. So thank you very much for that. Again, back to this being a human story with an economic story, we're going to talk now to another business. Brian Woods from Woods Power Grip is joining us to tell us about what is going on in their business and what COVID has done to it. So Brian, are you ready to go?
Yeah, Karen, thanks.
Great.
And we're a family-owned manufacturing operation out in Laurel. We employ about 140 people. Really, our niche is making products for materials handling. In particular, we make vacuum gripping devices that are used for handling, like mostly smooth sheet materials, like our biggest industry being the glass industry, but we also sell for marble and granite and steel, aluminum, pretty much all different types of building cladding, stuff like that. So that's kind of who we are. Again, not in the mainstream face of things here in the community.
Great, thank you. And I know you have like 140 employees, I believe you said. Tell us how COVID has been for you and your staff. You were deemed essential workers, and that was a lot of work, I believe. Tell us about that.
Yeah, I'll start off by saying, even though February seems like it was a lifetime ago, if, like some of the others that talked earlier in February, if you'd asked me what our year looked like, I'd say, God, all indicators are great. We're looking awesome. This is gonna be a great year. And so as things kind of escalated a little bit, with the COVID scene, there's a good chance that we were a little bit naive and in denial, I guess you might say. But we did at least take the time to put kind of a COVID response plan together in March, and seeing what was happening in Europe, which is a big market for us, we cut out all of our overtime at the beginning of March, and then really mid-March was kind of a huge wake-up call for us, because not only did they close the schools, which impacted several of our employees, but also we started to see essentially export orders just dropped out. They were gone. And you know, as they started shutting down different places throughout the country, we could see our domestic orders just kind of ratcheting down. And you know, we're going into the second quarter of the year. This is supposed to be our busiest time of the year. Everybody's gearing up for the summer construction season. And so it was a little nerve-wracking, to say the least. You know, I think the government did some things right with the Families First Coronavirus Relief Act that came out. I think, gosh, when was that? That was mid-March, I believe. And that really gave our employees a little more freedom to go spend some time with their children that weren't able to go to school, and make arrangements for more long-term daycare. And of course, things were slowing down for us. So during that second quarter, it wasn't a real strain for us production-wise to have people have to you know, spend some time getting family things arranged. But as a matter of fact, we actually got to a point where, I think it was around, it was late April 24th. We've come to the conclusion that, you know, things are so slow. We really just need people to start using up their leave time, because otherwise we have no idea how this is going to come back. And we could go into the second half of the year and this could come back quick. And now we got people wanting to use their leave time, and we're paying overtime when we've had a really bad for second quarter. So what we did is we required everybody from the new hire on the production floor to myself to use 80 hours of leave time between April 24th and June 30th. Again, it was a strategy just to kind of try and position us so we were in a better spot to handle hopefully a speedy recovery. And we have been fortunate enough that starting in the second half of the year, we did feel a substantial recovery. You know, that second quarter, like I say, was nerve-wracking, but you know, once we got into even into late June, but especially going in the second half of the year here, we've seen sales come back to maybe not normal what we'd want, but I'd say 90% of that. Of course, now, you know, we've had some other challenges, of course, as you know, as the caseloads escalated. We've had very high absenteeism, you know, most of it COVID related. And then we've also had a lot of disruptions in our supply chain, because everybody's throughout the country, or throughout the world, actually, I guess, is dealing with you know, high absenteeism and their suppliers not getting things to them on time and stuff. And of course, it just rolls down the line. And now, you know, it's one of the issues we have to deal with, trying to meet schedules and stuff.
Yeah, so thank you so very much for telling us about this. I know you've gone through a great deal of sanitization practices in the facility. And
Yeah.
How are you feeling right now about keeping your staff healthy and going forward? And we have just about 1 minute left. So tell us about your staff.
Okay, yeah, and we do. We starting at the end of March, when this all kind of flared up, we implemented a thorough sanitation process, not knowing, I mean, interesting things came out of today's discussion, and we realize now it's not transmitted as much through surfaces, but you know, we stop 3 times a day and wipe down everything. You know, our people have checklists of things they're responsible for, as well as if they leave a workstation, they're supposed to sanitize it for the next person, maybe someone on the night shift or whatever is coming in behind it. We want to make sure they come into a safe environment. So, you know, we've really worked hard with distancing and sanitation and stuff to try and eliminate or minimize any transmission within the building. And I think we've done a very good, well, I don't want to get ahead of myself, but we've been very fortunate there, I'd have to say. Yeah, sanitation's been a big issue for us. and you know, just again, distancing and keeping people from coming to work if they're sick. You know, that was a big one. We had to put in a pre-work screen thing where you have to acknowledge that you're healthy and haven't had any close contacts before you're allowed to log in for the day and start work. And that was because we had some people come to work, unfortunately, that were sick or were exposed to someone, and then as a result, we end up sending half a dozen people home. And gosh, it just kills us when, you know, you got to send, you know, 6 or 7 people home for a couple of weeks, and usually it always happens to your busiest area, it seems like. But that's been kind of some of our challenges, and you know, obviously they're ongoing, as everyone says. This isn't over, but I'm hoping we're in the 4th quarter.
So you guys, we are going to move into the next segment. We are going to be talking about challenges and opportunities for our medical hub. And as things go in the medical community, things come up. We had Dr. Elner and Mr. Lovelace scheduled for today, and Dr. Elner is not able to join us. So Steve Lovelace, you get to come on and talk to us about the medical hub and what the status is there.
Yeah, so challenges. Maybe I just give you a quick glimpse of current state, and I think that we're experiencing things very similarly at St. Vincent and at the Billings Clinic. Over a quarter of our patients in-house today have a COVID-related illness. So you think about that, we're at a very high census, so close to 215 patients. Somewhere between 55 and 65 of those patients are here with a COVID-related illness. Of those 55 to 65, at least 10 are in the ICU, and probably those 10 are intubated and receiving significant care. Today, we're probably experiencing somewhere between 50 and 60 of our staff who are out with illness. So either COVID presumed or COVID positive. And so when you think about some of the challenges, it's really meeting the demand of the patients coming to our organizations for care, which we won't stop doing, right? That's why we're here. That's it's our mission, and that's what we do, and frankly have done it well. And it's one thing I would just want to highlight as we talk about current state and challenges. I think we have come to see the tremendous resiliency of our healthcare organizations. I think we've also come to see the tremendous support the community has for our healthcare organizations. It was just a couple of years ago that Billings was recognized as one of the top 10 communities for hospital care. And I think that had gone underappreciated for a very long time. And I think as we've responded to this pandemic, I think the community has been able to see, I think with, I don't know, a different lens into healthcare and how we're responding and the blessing that we have in these 2 institutions here in Billings. So when you think about some of those challenges, it really is patient flow and how we expand to meet the demand that exists. And that comes in a variety of ways. And think about the teams that are managing this. It's 2 and 3 times a day of huddle. What is the current state? What is it calling us to do? What are the resources available to us to make that happen? And where do we go next, while all at the same time looking forward 3 days, 7 days, 2 weeks. And they've done a tremendous job in managing through that. I think those are some of the challenges. We've worked through some early challenges in terms of procuring the PPE, ensuring that we have medications on hand. I think a lot of those work streams now have solidified. Granted, if we see resurgence, that could become an increasing challenge once again moving forward. But I think those were some of the early issues we experienced in the pandemic. I think the challenges going forward will continue to be capacity and flexing to meet that capacity. And then just what happens with our workforce. And I think you'll hear us talk about workforce quite a bit as we have this discussion. ensuring that they're healthy and able to care for the community, I think are some of the challenges. Heidi, would you want to take a minute and talk about challenges beyond what I've shared?
Thanks, and thank you for accepting me as a last-minute stand-in for Dr. Elner. No, I completely agree with you, Steve. I think the experience is reflected similarly in both hospitals in terms of our capacity, the acuity of patients, the number of people we have in ICU beds. And we already had strains on our workforce. I think it's not a secret to anybody that we have, even before the pandemic, a shortage of nursing staff, CNA staff, therapy staff. And then that has only become more strained during the pandemic. And then you add on top of that the increasing number of patients we need to care for, plus some staff in quarantine. So we've certainly had challenges, but I would also agree that the resiliency of our medical staffs across the board and at our long-term care facilities at both hospitals, at Riverstone Health has been amazing. I just, as someone who is a family physician in the office and not currently in the hospital, I've watched with concern with my colleagues in the hospital as they've been working very long hours, taking care of a lot of sick people, watching people pass away, the unpredictability of this virus sometimes, but also so in awe of how people have flexed, how our systems have flexed, the creative ways that we've managed to increase the capacity quickly to be able to care for anybody who comes through our door, not just the COVID patients. Some of our nurse practitioners going back to work as ICU nurses to help out. It's impressive, and we're grateful, very grateful for the support of the community. You know, I think it's important to remember the why that was spoken about earlier. Dr. Littlefield spoke about it so well. We talked a lot at the beginning of the pandemic about flattening the curve and why we needed to do that. And I think that's still a really important message to remember, why we need to continue to be vigilant with this virus, even though a lot of us are weary of it, is that we need to be able to keep the acuity of our patients manageable. We need to be able to give them care in our hospitals. As somebody else pointed out, we're a regional medical center, and we have responsibility to a large area that we are taking care of. So I think one of the other things is that we appreciate from the economic standpoint, I think there's one of the myths is that the hospitals are making a lot of money on this pandemic. That's absolutely not true. We are grateful for the funding that we received in some of the earlier relief acts, but it's a fraction of the costs that we have. So I think, like with everybody, we will have our own economic challenges going forward. And so we just need to all collaborate to figure out how to manage together.
So Steve, I think one of the other questions that you asked us to touch on was, how has this positioned then our organizations in the community looking forward? And as I think about that, just harken back to the personal stories that have been shared. And I appreciate how you've woven them into the conversation today. Came across something earlier today, the concept that we're all experiencing our own reality. Be kind. And we see it through a different lens based on what we do and how we do it, the implications that it's having on our families and loved ones, and our work and the work that we do. And I think we have demonstrated that to a large degree, and I think we'll need to continue to do that as we work through the pandemic, recognizing I am impacted, but so is everyone else around me in their own way, and that need to be aware of that. As we look forward, I think that you can take confidence that we will emerge from this, and we will emerge from this stronger from a healthcare standpoint. I'm confident of that. We already are changing how we work. We're changing how we operate. I think we've learned some things through the pandemic that have catapulted us forward in ways that would have taken years to get there otherwise. as you think about things like telehealth. Now, I think we're going to have to get our systems in line to support that, meaning payment mechanisms and those kinds of things. But as healthcare organizations, we had already instituted process to be able to accommodate patients' needs from a virtual standpoint. And this just thrust us into that realm very rapidly. And we're there. We're able to care for patients remotely and do it very effectively, which when you think about the waste associated with travel, getting to and from an appointment, that can be eliminated. So now how do we keep that alive as we emerge from the COVID epidemic? I think we're learning some things about workforce. We're going to have to give greater focus to workforce in new and different ways as we emerge from the pandemic. And I think we're well positioned as a community to be able to do that, whether it's at the provider level, all the way down through all levels of staff within our organizations. We're learning things about our physical facilities that really need to change in order to accommodate this concept of flexing up and down to meet the needs of today. And I'm sure as we build and look at facilities into the future, we'll do it differently moving forward because of what we are learning right now. I think we've also proven that we can be much more nimble than we have demonstrated in the past within this industry. And I think you'll see that we'll try to hold on to that nimbleness as we emerge from the pandemic looking forward. I think the other thing we've seen is just the tremendous importance of partnership. And you've seen and experienced that today. We have great partnerships within the community, within the state, within the region already. I think you're going to see a furtherance of those partnerships again as we emerge from the pandemic. Heidi, others that you would add?
No, I think you said it very well, Steve. I think I'd like to emphasize the point that you made about we've shown ourselves that we can be a lot more nimble than we thought we could be. And I hope we continue to apply the lessons that we've learned in this pandemic.
You know, Karen, I don't know if we have more time, but I want to reflect quickly on something John Felton said when he was reminding us that we enjoy the status as the regional medical hub. And from my perspective in my chair, that means economic activity and churn and everything that means. But you serve that role in good times and in difficult times. And what he also said, it took 40 years to build this infrastructure that we have. I'm hopeful, given just my interaction with the two of you and the systems that you are leaders in, that the work that you're doing now and the learning you're doing now really has the opportunity to take our regional medical world-class healthcare status, frankly, to a whole nother level. And you know me, Steve, Heidi, optimistic, always thinking big, maybe to my own detriment sometimes. Is that an overstatement? I really feel that we are positioned to then take that next step based on what we're learning today. And it could mean important things economically. It could mean things for our status as that regional healthcare provider.
Yeah, and we enjoy a great position in that regard today, right? If you are experiencing illness in the state of Montana, you want to be in Billings. This is where you want to be cared for. We see it in our, CMS 5-star recognitions 2 years running, in our health grades awards. We see it in Leapfrog, and I mean, just these accolades that continue to come in unsolicited just because of the way that we do things. And I think you'll see that that will continue, Steve. So how do we get even better, even faster? I think we're always challenging ourselves down that path. I think the learnings of the pandemic will help us go even faster.
Yeah, I completely agree with that. I think we before the pandemic have, you know, been embarked in a look at what can we do to make ourselves even better, build on our culture of safety, build on the work we've already done. And while the pandemic has shifted that a little bit, or I think that's still something we're always challenging. Both systems are challenging themselves to do things better, safer, and look out for our region. Look at partnerships. Look at what we can do to be here for when people need us, but also keep care in communities in rural Montana, and yet raise everybody's boats so that we all can and do a better job of taking care of Montanans wherever we are.
Heidi and Steve, your message to us today was so important and so well heard. Thank you very much. We know that you and your staff are tired, that you are working hard, and all of us in the community will do our very best to give you grace and support you as you help us to stay healthy. So thanks for everything you're doing.
Thank you very much.
Yes. We are going to talk to the point that Steve mentioned, that this is an opportunity to grow and it's a way to look at things in a different way. And Jason Leninger is going to be joining us and talking to us about why he's optimistic about Billings. He is with Hub Real Estate Company. And Jason, jump on here and talk to us about what's happened for you this year and what you're thinking going forward.
Sure. So first and foremost, I'm very humbled to be a part of the caliber on this panel here. And I hope this doesn't come off as naively optimistic, but that is just who I am as a person. I think Billings is well versed in kind of the problems that we faced from a housing standpoint. This year in 2020, surprising to all of us, we've outsurpassed all of our previous records as far as home sales. Which I don't think that any of us suspected at the beginning of 2020, but it's kind of flipped everything on its head. Right now, we are facing a pretty severe shortage of inventory. I think that COVID has put some sort of implications on that kind of facet of our industry, because people don't want to be walking around other people's homes with COVID, and understandably so. But I think from a community standpoint, I think I've got a very positive outlook. We're well diversified in the sense of industries. The cities that are really focused on one or two industries might take a big hit, but we have many legs of a chair, so to speak, to stand on. So we're very well balanced in that aspect. I also think that Billings isn't as intimidating as a lot of other cities. We are a small town feel, but we've got that big town attitude, which I really love, because that kind of props up our commonality of values, so to speak. So we are still big enough to support each other. But we still have that thoughtfulness of the small town feel, which I really appreciate and give credit to the city of Billings with. But I'm hopeful. I'm very hopeful. I think 2021, from a housing perspective, is going to be equally as fruitful for a lot of homeowners. We have a lot of pent-up demand, and I've got a very positive outlook from the housing aspect.
Jason, excellent. Thank you so much for telling us that. We're going to let you go ahead and go off camera, and we're going to move on to our next positive little message here. And this is from Jessica Hannison with Hannison Homes. So Jessica, please jump on and tell us your story. You are a new business owner right here in the middle of a pandemic, and we want to know what that's like and how you're staying successful.
Yeah, thanks so much for having me. A lot like Jason had mentioned, I don't want to come off like too optimistic either, because I come on here and I listen to this, I'm like, oh my gosh, this is like, I think especially in real estate, I'm kind of affiliated to real estate in many ways. I work with either people that own a home and remodel it, or building a home. Just about anything home related we're usually involved with in some manner. And so I guess we're not even a year in, we're almost there as of January 1. So I think starting the beginning of the year, it was guns blazing, and then the pandemic hit, and it was kind of like, oh, wow, I've worked really hard to get to this point. Nothing's going to stop me from having it take away from me. So I think in sheer panic and just determination, what we did is we ended up adding a full retail store to our already. So what we specialize in is in cabinetry and countertops. And then we brought on a full interior design firm, but then we also threw in retail into the mix, which obviously as the pandemic progressed, we shut down all those things. Certain businesses, facets of our business was deemed essential. So we still had to do some things with that, but retail was not one of them. So we pivoted and we upped our website, social media, and then we made a full e-commerce website for our Shopify account. And that was mostly retail because I had a whole warehouse of furniture, accessories, everything just sitting there, thousands of dollars. And so I still wanted to try and get it out, cash flow, all those things. And so in doing that, it made us do something we probably would have put off for the long term. And it just made us be successful on the retail side when we didn't think it would be. And then one thing that I think has been crucial is just the support of the community. I think that they ultimately want us to be successful. And I think too, just having that support, and Jason kind of said the small town feel. I am from a small town. I come from Glendive, Montana, and that little community has also just fully catapulted me and supported me too. So I think it's a conglomerate of just Montana across from the eastern side to the western side has supported us. And I think what also has ultimately made us really successful is the fact that home has never been so sacred as it is now. People are home more often, and just the value that they're putting to what their home means to them, and creating a place in an environment where they can kind of control outcomes has just been a lot more prevalent than maybe in the past, and just having it be something that reflects who they want it to reflect, which is them. And so I mean, I came into the year in March fearful, and it was like nothing I've ever experienced. I mean, I increased my staff. I can't fit any more people in my building. We are absolutely swamped, and I'm so thankful. And it's just been, it's funny because I come off very optimistic, and that not even just optimistic, but more so thankful, because it was bountiful, and it was all these things that I think a business owner hopes it to be, especially in their first year. And I think one thing that you guys touched on in the last segment was just being kind. And I think when you're kind and when you're working with people and you give people grace, I mean, we have seminars on how to talk with people during the pandemic because people it's different. And so I think that just being kind and giving people grace and working hard and doing what you feel like is your very best has been the key to our success this year.
That is absolutely beautiful. Thank you for talking us through that. There were a number of things that you said that were so very important. One, you realize that the community wants you to be successful, and we absolutely do. Your success gives us a point of hope to look at. Yeah. And so both you and Jason and other people who are experiencing that, we do want you to be successful. That's what all of this is about. And home is absolutely more important than ever before right now. People are so focused on that. Yes. Yeah. Thank you very much for telling us your story. And we hope you continue to be successful.
Thank you so much. Thank you for having me.
Yes. Glad that you are here.
Yeah.
So you guys, we've been on quite a journey today, the ups and the downs of this. And I just always want you to know what an amazing community that we are in. And we have some amazing leaders that are helping us to stay healthy, both physically and economically. Steve, talk to us a little bit about the Build Beyond game plan and what you're thinking at this point.
Thanks, Karen, and you're doing a great job of keeping us on schedule. We are a little bit ahead of time, so I'm probably going to give the abridged version of this just out of sensitivity. You realize it gets dark now and it feels like we should be home having dinner right now, but yeah, bear with us just a little bit more. I want to share with you a little bit of a framework of how we view economic recovery kind of going forward. Somebody said, I hope we're in the fourth quarter. I kind of think we're starting the third quarter. You know, we just had a halftime, and maybe this is our halftime kind of pep talk and strategy. And now we got to lean into the third quarter and fourth quarter because there's still work our community needs to do, both locally and regionally. Melanie, I'm going to have you share maybe just a few slides, and I promise you I'll go through these very, very quickly. What I'm going to show you with this slide, if we're able to pull that up, is just the 3 stages of our recovery plan, which include the initial coordination and response. And that's kind of the work that we're still doing today, right? That's just pulling the team together. And we've had a team of people, 40, 50 of us have gotten together every week since the end of March and meeting on a weekly basis, communicating together, talking together, trying to make sure we're filling gaps, supporting business needs, reaching out to our healthcare partners, establishing and building those relationships toward a particular goal. Stage 2 of our recovery plan is business recovery and stabilization. And every business in our community is in a little different part of this stage. Some are still trying to respond and react. Some have actually gained some traction in economic recovery. Some, as you've heard, are blowing the numbers out of the water from last year, but some are having a tough time. Some are 50% below where they were last year, and they're very nervous about what that next quarter is going to look like, that Q1 of 2021. And so this whole work around business recovery and stabilization, that pace of that looks so much different depending upon what business that you're involved in. And what we're trying to do mostly in that stage 2 is have businesses learn from businesses about what it takes to react and pivot and try and find a new path forward and gain some traction. I want to spend just a second though talking to you about stage 3, and given the time that we're in now, what I'm going to have you do when you have a chance, if you haven't seen this yet, go to the website yceconomicrecovery.org. You will see this whole recovery plan laid out, and you'll get details about each one of these 3 stages. Stage 3 is about positioning ourselves for the future. As you've heard the term resiliency and flexibility and pivoting, all that today, that's really what stage 3 is about, is positioning our community for the future. We have some basic objectives that we're trying to accomplish in that stage 3. You'll see them listed there in that plan. We're going to talk about cultivating new startups and supporting our local businesses and building resiliency by leaning into our strength as a community and as an economy, like our healthcare system and the opportunity that has for us as well. You'll learn a little bit about what we mean by saying capture our small metro advantages. You heard Jason talk about we're not an intimidating community. That's attractive to people. And so there's a whole list of objectives there in that stage 3 document that you can get on our website and learn a little bit more about. What I want to leave you with today is what I call essentials for today and tomorrow. And Melanie, if you want to just go to the next slide, I will give you what I call 4 essentials that we can all be doing for today and tomorrow. These are images of local businesses in our community. I'll let you guess which ones they are. If you love a cinnamon roll, you'll know the lower right-hand corner is Stella's. If you love something a little different, maybe Sassy Biscuit, Waffles there, and then Base Camp, all those companies that you can reflect on. The one in the top corner is Joy of Living, and we have lost our Joy of Living retail outlet in downtown, just in downtown, and that was a difficult thing for the health of our downtown. So the first essential for today and tomorrow, you've heard it, is please lean in to our local business community. Before you easily click, sitting there and buying something off the internet, having it delivered, see if there's a local source for that. Or put your mask on, walk out the front door, walk to that local retailer. They're all protecting both their staff and their customers. That is an absolute essential for today and tomorrow that we can be leaning into. I'm going to encourage the community to think long-term and create more opportunities. But today, where the rubber meets the road, it's about leaning into our current businesses. The second thing I'm going to ask us to do that I think is essential is to stay healthy. Stay healthy individually. Do what you can to get out and exercise and be a part of that. Where do all those things that we heard our healthcare providers and our scientists and the epidemiologists and our other doctors and professionals that were part of our dialogue today, all encouragement about the protocols and practices to be healthy. My point with encouraging you to individually be healthy and adopt those practices as an individual focus is that it impacts the person next to you, it impacts your coworker, it impacts your neighbor. So actually those first two imperatives about shopping locally and staying healthy, that's just about being a good neighbor and doing the right thing to take care of yourself, and then that has an impact on the person next to you. So those are the first two imperatives: shop local, take care of our local business, and then stay healthy. The third imperative, the thing that we can do today and tomorrow, is to maintain our business healthcare partnership. I can't say how much I appreciate John Felton and his team, our healthcare community, and their willingness to spend time communicating with and dialoguing with the business community. It has been tremendous. I think we're frankly a national model in how these two voices come together around the same table and try and stay in step with one another as the community moves through this. So that's an important essential for today and tomorrow. Let's stay committed, regardless of what the journey looks like over the next couple of months, to this partnership that we've established between business and healthcare. My fourth one for you, my fourth encouragement is we do need to have a build beyond kind of mindset. We need a clear picture of what that means and looks like. And so what I'm showing you on the screen now are actually master plan drawings, things that are on the drawing board in our community that would add assets and amenities to what we look like as a community going forward. And they're in various stages of planning and investment and development, but it gives you a glimpse of how, as a community, we've been talking out loud together about amenities and things we need to invest in. And beyond these amenities, basic infrastructure, parking downtown, other things that are essential to attract talent and new private investment. Having that build beyond mindset is taking hold of these visions we've created and turning them into reality, executing on what that looks like. And we're doing that because we still have work to do economically. I can tell you, I had a board meeting this morning, 33 board members. We had a roundtable discussion. Almost every single business leader at our board meeting this morning said workforce remains a challenge. It was a challenge pre-pandemic. It's still a challenge now with more dynamic nature to it, more uncertainty to it. It still remains a challenge. So our ability as a community to come together, continue to be thoughtful about investing in ourselves, visioning about what we look like as a community going forward, will strongly position us to attract and retain our talent, and then also to compete for new private investment on a regional basis. And the last slide I want to show you is having a build beyond mindset means we say yes to incremental opportunities. We're not going to be able to do all the things I showed you on that slide or all the things we aspire to do overnight. We want to take it one step at a time, seize those opportunities that are in front of us. The picture you have right here with the big sign build on it is a group of community leaders, volunteers that came together and for years have been working on promoting the development of the Skyline Trail. Earlier this year, we got word from the federal government that we were able to secure a grant that will support the development of the Inner Belt Loop and the Skyline Trail. So thinking incrementally, staying committed to those opportunities gives us this kind of success as a community to be able to actually put a shovel in the ground, build something that we've been dreaming about for a number of years, and start making those incremental steps. So my encouragement is to have that build beyond mindset as we work through the third quarter, fourth quarter, whatever quarter we're in. We still have to be thinking about what we want to look like and be and act, and what our economy needs to look like, and how to get there as we move through this together. So Karen, I'm gonna stop at that and just say thank you from me to everybody that participated today, all the expertise that was brought to bear, those of you who devoted 2+ hours of your day to just listen and participate that way. I really appreciate it. I really appreciate the partnerships that we've had around the Economic Response Recovery Team, the Chamber in downtown, and other key partnerships, the city, the county. It's really made a big difference. A lot of private sector partners, and their dedication, I can't tell you how much it's appreciated, and frankly, still needed as we move forward. So thank you.